that's the problem. It's controlling that side-to-side movement. There's nothing at the knee that actually controls that. It all comes from either the hip or the foot and ankle.
So now the knee is essentially doing more work than it's supposed to.
Exactly, like it's not able to withstand those extra stressors that are being placed on it because it's not designed to move in that way. So things like getting your hips really strong can be important. Getting mobility in your ankle can be really important to make sure that those mechanics can be as optimal as possible.
Right. So for some of my people, yo, thanks for locking in and welcome to the Gym Life Podcast. Today, my guest is Hillary Brown. She has her doctorate in physical therapy. We're going to be going over different physical pains you could be feeling, how to address them, different signs to look out for. You're just not going to want to miss this. Let's vibe out. What's up, Hillary? Welcome, and thank you for coming down.
Yeah, thanks for having me.
Of course, of course. So for anybody who doesn't know, we work with the same client. Right?
Yes.
Sonia, who's been doing personal training with me for about 4 years now, also does physical therapy with you.
Yes.
Right?
Yeah.
Which is cool. So we're constant exchange of information.
Exactly. Yeah. We work together as a team, right?
Yes, you have to. And I wish more trainers and therapists would do that more often.
Right.
Right?
Yeah.
Instead of seeing it as more like the client should only see one person versus two in tandem, which really helps.
Right. Yeah. I mean, I think we both bring different things to the table and we can complement each other really nicely. So,
yes.
Yeah.
Yeah. So give me a little bit of your history, background when it comes to physical therapy, where you went to school, how you got into it, everything.
Yeah, so I've been a physical therapist for the past 4 years. I work at USC right now where I treat patients, but I'm actually a professor too on top of that.
Oh, wow.
Yeah, and I actually went to Northwestern University to get my doctorate in physical therapy.
Okay.
So we are doctorate level professionals, but
oh,
yeah.
Wow.
And I primarily treat orthopedics. I also treat public health conditions too, so.
Okay, so orthopedics and public health.
Yeah.
Tell me a little bit more about orthopedics.
Yeah.
What exactly does that entail?
Basically anything from head to toe where someone comes in with either pain or an injury that is more muscular in nature usually, or even like a fracture. They'll come see us. Sometimes patients have gone through surgery and they're seeing us post-operatively, but we're really just trying to help people manage their pain and get back to the things they want to do in life.
That's huge.
Yeah.
And I think what's really important is that people aren't always going directly to surgery.
Right.
Which is a big issue.
Yeah, I know. That's something that really drove me into my profession is I want to do everything I possibly can to help patients get the tools they need to manage their care themselves, basically, and not have to be so reliant on our medical system that we're so reliant on in the US, where it's medication, surgery to really manage our pain. There's so many other options.
Oh, yes, definitely. Okay, so I really want to get into that.
Yeah.
Now, everybody knows when we come to do this podcast, we're going to work out.
Yeah.
And you're in pretty good shape, so we're going to go through a few movements. I'll break them down for you.
Okay.
Today, we're going to do a lot of body weight stuff.
Sounds
okay,
good.
so the first movement is going to be a forward lunge to oblique twist. We're going to do 10 on each leg.
Okay.
After we do 10 on each leg, then we're going to go for a wide stance squat, reach down and then reach up. Then after that, we'll be down into a plank where we'll go knee tucks. After the plank to knee tucks, and we're going to finish up with forward hinges. Okay? So I'm going to start the clock. We'll go through the warm up and then we'll get into the movement series.
All right, sounds great.
Body workout. Get
Okay,
ready.
cool. So for the warm up, each movement is going to be 1 minute.
Okay.
I want to start off with a standing quad stretch. We'll bring back and hold, and we'll alternate for that 1 minute.
All right.
So
Warm up.
you touched on something that I'm very, very passionate about, which is essentially a culture that we built within the healthcare system as far as being reactive.
Right.
Right? We push, do as much as we can. We ignore until it gets so bad that we either need surgery, we need medication, and now we're trying to fix a problem. And then we end up putting ourselves back in the same situation because we don't treat it from its base or foundation.
Right.
Right?
Yeah, I totally agree with that.
So with that being said, what are some injuries that you've seen that have been reoccurring that come in as far as your orthopedic practice?
Yeah, so I mean, I think It depends on what the age demographic is and what types of activities those people participate in on a regular basis. Knee pain tends to be something really common from the lower body.
Okay.
And that can take a lot of different forms, right? So they can have pain that's like mostly their kneecap. They can have pain that's more from a tendon perspective or like a meniscus injury more in the joint.
Okay.
So when I say knee pain, it's actually a lot of different things that can fall into that category.
Right, and so many people, and I see it, right, when people come to train, it's like, oh, my knee's bothering me. But that in itself can be a complete like array of different issues.
Exactly. Something else that's really common kind of throughout society is back pain, right?
Okay,
it's similar.
Knee pain, back pain,
Back pain takes a lot of different forms as well, and most people are going to go through some level of back pain in their life. And for the most part, it's not a big deal, but it can become very debilitating for people who, like you said, kind of don't take care of it in the moment or do things to help prevent it. Movement.
Yeah, and one thing I like to tell my clients all the time is the body whispers before it yells.
Exactly.
Right?
Yeah.
So a lot of times what is important, and then we'll reach down, and then we'll reach up. What is important is when your body's whispering, whether that pain is in your knee or your back, and it's just like, you're like, I feel a little bit off in my knee or off in my back. That's when you want to address it.
Right. I think that's the key, because at that point, you're still able to usually do most of the things you want to do. It's when you put it off, then it can actually take a huge impact on your life and really almost shut you down at times, which we hate doing. We want people to keep moving.
Right, so a lot of times we'll think, I don't want to address this now because it's going to take a day or two, but then it can end up taking weeks, months that you end up off because you didn't address it initially.
Exactly. Yeah, so I think being able to work with people that actually can help you identify that early on and kind of encourage you to take the necessary steps is huge, whether that be a healthcare provider, personal trainer. I think there's a lot of different people that can help guide clients and patients during that journey.
And we'll go reverse fly. We'll go here and then up. Okay. Yeah. So let's start. I want to start with knee pain because to me and I'm sure you've seen a lot of it. I've seen a lot of it where there's so many different kinds of knee pain. What are some of the things that you think people could pay attention to as far as light little triggers or indicators for us to be aware that we need to do something? So what are some symptoms that people could be aware of when it comes to knee pain?
I think when you start to feel pain that's more in the joint versus like muscle soreness that you would expect, that's kind of a red flag that something's not quite going right in the body. Okay. So that's the kind of pain I tell people don't ignore. Okay. So what I mean by that, usually people describe it as like, it kind of feels like it's deep in my knee. Sometimes the kneecap itself can create pain, and that's not usually a muscular type of pain. That's really the joint and the bones saying, hey, something's not quite right here.
Right. Okay, so now, and we'll go forward circles. Okay. So now if somebody's feeling pain in the joint specifically, we're talking about the middle of the knee?
Yeah, okay. Exactly.
So middle of the knee, you're feeling that pain there. What are some things that they could do to start like kind of testing on themselves?
Yeah, so I think having a sense of what brings on their pain is huge. A lot of times with joint pain, it's doing either repeated tasks that can bring it on. So like we're in an area where people like to hike a lot, and sometimes going up and down heavy elevation can sometimes be aggravating if there's something underlying in the joint that's a little uncomfortable. Or
reverse back.
Yeah. Or even like doing like a deeper squat. Sometimes that can put a little bit more stress on the joint, which isn't necessarily a bad thing in general, but if there's some pain, that can just, again, give you the signal that maybe this is putting too much stress on a tissue that's already a little aggravated at the moment.
So what I just heard are okay, so we'll go through and start with the forward lunge. Okay. So you have people who work out daily, go work on a daily basis, or an activity, whether it's surfing or hiking or biking, and little by little, they could be aggravating the tissue.
Exactly.
Okay, in that knee. And we'll go here. Yeah. What are some preventative things people could do? And I'll give you an example. I have a client that's a tattoo artist, right? Okay. So on a daily basis, he's in a particular position all day. Yep. Now, this is people's livelihood, right? This is how they make money. so they can't necessarily say, all right, I'm not going to do this anymore. This is how they take care of themselves. Yeah. What are some things people could do on a daily basis that's feasible to kind of be as far as preventative measures to negate some of that knee pain that could come?
Yeah, so I think in that instance, they almost have to treat themselves a little bit like an athlete.
Okay. I like that.
Yeah,
I really like that.
Because, I mean, if you think about the demands of certain work, whether that be repeated movements or prolonged positions, it's a lot of stress on the body if you're not preparing it for that stress on a daily basis. So I think one of the most beneficial preventative measures is getting into a gym regularly, getting comfortable with getting stronger, especially in the muscles that maybe taxed a little bit more in those positions. And then recognizing that things like eating well, getting correct sleep, all those things are going to be really important to making sure your body's functioning at its most optimal capacity.
You touched on a few things. One, I'm gonna work in reverse. I think some people don't realize that the foods they eat could cause inflammation and pain in those joints. So a lot of times they'll go directly to, oh, do I need to ice it? Do I need to stretch? Well, yeah, those things help. But if you have a diet that's inflammatory, then it's going to contribute to some of that tissue swelling and joint pain.
Absolutely.
Right? And then the other thing you said, what I absolutely love, and I never thought of it that way, is for people who, even if you're sedentary or essentially you're not moving on a daily basis and all you're doing is just going to work and coming home, you still need to treat yourself like an athlete. Right. Which means preparation, getting up, stretching, all those things.
Exactly,
right?
exactly.
And then we'll go plank, knee tuck.
Okay.
We'll go 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Then we get forward hinge last. Yeah. It's super. So even like incorporating a morning stretch routine.
Right.
Before you go to work.
Yeah. And I would say one of the biggest barriers for a lot of people is trying to find time for these things. That's like the overarching theme that I hear a lot from patients and even just, I mean, people in general in society. We're so crunched for time at all times. So I think something simple like that stretch routine, maybe just having like a 5 or 10 minute routine you get into a daily basis, it can make a difference.
Yes.
Doing something is better than nothing. It doesn't have to be, I got to do this hour-long session every day in the gym going really hard. Try to meet somebody where they are, because the best exercise is the one you're actually going to do, right?
I was just having this conversation with a friend the other day where they wanted to get into a fitness routine just to feel better. And I could tell through the conversation, they were thinking, if I don't get 30 minutes to an hour, it doesn't count. Like, no. Yeah. Like, if you could just take 5 to 10 minutes to stretch in the morning, stretch in the evening, even get up from work and do a stretching routine, that's going to help you immensely.
Exactly. Right. Yeah.
I love that. Okay, so knee pain, noticing if you feel any pain in the joint, tissue, inflammation. You want to maybe start by stretching, icing. How do you feel about ice?
Yeah, so ice I think is great for managing pain. Right?
Okay.
So if you have an aching sensation that's like it's impacting your sleep maybe, sometimes icing can help dial the volume down on that pain. Okay. It may help a little bit with the inflammation. It's still kind of up in the air of how effective it is for managing that, but really it can help you make you feel more comfortable when you're dealing with pain.
What are some of the remedies that you suggest for inflammation? So icing one. Icing,
I would say modifying whatever activity is irritating in that moment is a huge thing, because the more you put stress on a tissue that's already inflamed and irritated, you kind of feed into that cycle. And it's not to say don't do activity, it's just finding ways to make activity work for you in that moment.
In other words, if something's bothering your knee, stop.
Well, stop doing the activity that maybe like a heavy lunge or squat that may be aggravating. Maybe we're doing more body weight stuff at that point, or finding a lighter load that the knee can tolerate then. Because I don't like to shut people down completely. When I can.
Modifications. And this goes, I think this is super important for our people out there who work out on a consistent basis, that no pain, no gain concept.
Yeah.
It's like, yes, you want to have the discomfort of burning muscles, feeling like the muscle is working, but any pain in those joints, correct me if I'm wrong, that should never happen.
Exactly. I think that's distinguishing like pain from soreness. Soreness in like the muscle it's okay. It's kind of desirable, as you said. Like, we want to challenge you to the point where you're making those adaptations, getting stronger, making gains in the gym. But joint pain is not something that's going to facilitate that type of goal. It can actually hinder you.
Right. So learning that difference between muscle soreness, which can lead to, you know, gaining muscle, leaning out, things like that, which are important, versus just feeling pain.
Right, exactly.
In the joints.
Yeah.
Yeah, that's very important. And I think even getting rid of that thought or that theory that when you go to the gym, you have to feel the pain, but also that if you cut back, you're going to stop seeing results.
Right.
You could still do body weight stuff and still see results.
Exactly, exactly. I think there's ways to challenge the body in a sense that you don't always need this heavy equipment to do it. And I think as long as you're getting guidance on how to do it, there's a lot of effective strategies out there.
Exercise.
Right.
So like working with a trainer, like I'm sure there's a lot of ways you challenge your clients. And
Yes.
it doesn't have to necessarily be getting a barbell on your back every single time you're in a session with you.
Yeah. It's, you know, it's funny. I've always suggested to people, and you can tell me your thoughts on this, and we'll go back, we'll lunge rotate, is some people cannot afford physical therapy or a personal trainer, which is understandable.
Yeah.
If you can't afford those things, I think it would still be beneficial to at least see a professional once.
Yeah, I
Just
agree.
to learn body mechanics, learn your body a little bit better versus just completely going blindly, because there's so much misinformation out there.
Exactly.
As far as they could be watching these Instagram videos or these YouTube videos and getting their workouts.
Exactly, yeah. I mean, I think it's great that there's so much information out there, but the layperson has a hard time filtering through and seeing what's good for them particularly too, because just because it's good for one person doesn't mean it's perfect for your body.
Right.
So I think that guidance is huge.
Uh-huh.
And yeah, I do think, especially if it's something that's completely foreign to them, trying to get someone that can focus in on your form and give you some feedback in real time that, hey, this may end up leading to some pain and discomfort down the road if we continue to do it this way, can really save them money in the long run.
Right.
Right? Because you're preventing, it goes back to that reactive versus preventative type of thought.
Yes.
Right?
Yes. Which is very important. So now what we're saying is, one more, and good, then we'll squat reach, is make that initial investment, one session, maybe 2 sessions.
Yeah.
Take, you know, a weekend off from something that you think would be a little bit more casual and invest in your body and information and learning yourself. And then you're going to have that forever.
Right.
Right? Once you learn how to move your body in a way that's conducive to your health and not contradictory.
Exactly, exactly. And I would say too, like, trying to look out for resources, because a lot of times there's free consultations or very low cost consultations in both the fitness industry and even in the healthcare world sometimes, where you can get that initial guidance and see, do I think I need more than that, where I need to make a little investment early to help my future self be well?
Yes. Yeah. I want to get into some of the back pain as well. So joint pain, we're paying attention to the joint, feel inflammation, pain, anything like that. Then we want to start by making sure we're addressing the inflammation through ice, or we're addressing the inflammation. I mean, in addition to, we're addressing the inflammation by paying attention to the activity and allowing that joint time to kind of heal itself.
Exactly.
Because the body will heal itself if you give it time to.
Yeah, in most cases, yes, that is absolutely correct.
What is so one of the areas that I look at with clients is the connection between the IT band and the knee.
Yeah.
What are some areas within the quadriceps, within the hamstrings, within the calves that tend to lead to knee pain that you found, where it may just be like stretching and foam rolling these particular muscle groups?
Yeah. I think for the knee, having strong quads is really important for many things. So if you're looking at something that's directly in relation to the knee, meaning like located very close to the knee, quads tend to be a big factor. But a lot of times people don't realize the hip and the foot actually has a huge impact on how our knee moves.
The hip and the foot.
Yeah, so the knee is often the victim of some sort of weakness or coordination issue occurring either more proximally at the hip or down by the foot. So
And maybe even lack of mobility?
Lack of mobility can be one. Not being strong in an area. So our knee is designed to bend and straighten out.
Okay.
But a lot of times when people have issues with their knee, it's not so much that's the problem. It's controlling that side-to-side movement. There's nothing at the knee that actually controls that. It all comes from either the hip or the foot and ankle.
So now the knee is essentially doing more work than it's supposed to.
Exactly. Like it's not able to withstand those extra stressors that are being placed on it because it's not designed to move in that way. So things like getting your hips really strong can be important.
Okay.
Getting mobility in your ankle can be really important to make sure that those mechanics can be as optimal as possible.
Right. So for some of my people who work out consistently, have an idea of what hip mobility is, ankle mobility is, strengthening up the hips, strengthening up maybe the glute medius.
Exactly. That's
right?
a big player. Yeah.
Right. So these are some things that if you're familiar with those, these are some things if you have some experience in training, this is where you want to address.
Right.
Bands, you suggest maybe some resistance bands?
Yeah,
Okay.
I think that's a great way to even start a workout too, is warming up, getting those muscles prepared for things like a lunge or a squat. So it's reminding those muscles, hey, you should probably be working as we're doing this to keep our knee in a good place.
Yeah, it's funny. You reminded me of a story that was so funny. So when my clients come, we go through a light cardio warm-up.
Okay.
After the light cardio warm-up, we go through a functional movement warm-up. So I'll give them the resistance bands, and it'll take like 10 to 15 minutes. Then we start our weight training, right? So I try to wake up and activate all the muscles one by one. So one of my clients, she left out of town, and she goes to work out by herself. She comes back, back pain, knee pain. And I said, did you warm up or do any activation before, what we've been doing for the past 3 years? She goes, oh, I thought that was our time when we chit-chat. I was like, no. I was like, no. All that stuff is important.
Yeah.
But I laugh because I understand it, because we did it so routinely and so matter-of-factly. She didn't understand how important that was.
Yeah.
Right? And I think that's what some people miss, is they think like, okay, let me sit here and take the band and activate this. It looks cute, but is it really doing anything? And it's those little things that we don't pay attention to that help, and they're more preventative.
100%. And I think that's where people just jumping into this without any guidance, they often miss that step because it's not something where it makes sense inherently to do when you've been told to do it, but it's not something I think most people would naturally do.
Right.
Go taking that extra 5 to 10 minutes, which seems like, I don't know if I want to spend this extra time doing this, but you're right. It can be huge on that prevention piece.
Yes,
So-
yeah. And it's not as sexy,
Right.
right? Like, you know, they like squats with the barbell, that's sexy, push all those things, that looks good, it looks great. And you feel very instant gratification, very like, you know, the instant burn. So people are like, oh, this is doing work.
Yeah.
But just that little 5 to 10 minutes almost seems tedious. But when we learn the impact that it has, it'll help for us to stay consistent with it.
Exactly. Yes.
Right.
I think that's so well put.
Yeah. Okay. So tell me some of the back pain that
Yeah.
you encounter.
Yeah. So again, this can vary from person to person. I would say like my younger individuals, a lot of times they'll deal with things like disc pain. So you may have heard of someone saying like, I herniated a disc or my disc slipped out of place.
Yes.
I want to first say that it's not anything to be fearful of, right? It's not like things are completely moving out of your spine. Right. But sometimes things can get irritated, similar to what we just talked about in the knee. And that sometimes can get exacerbated with certain movements, especially where you have to bend through your back. It can make it really uncomfortable for people to feel safe moving. And this is where it might be a time where this is the appropriate time to get an investment and see a PT.
Okay.
But I think more importantly, if they get that guidance early on how to brace appropriately through their abs and move in a specific way, they can prevent those types of things from happening in the first place.
Core strength.
Yeah, huge.
That's at the base. So again, we're getting into, which is insanely important, the fact that when you feel pain somewhere, be it your knee, be it your lower back, a lot of times it could be because that knee or lower back is doing a job it's not supposed to be doing.
Exactly.
So now it's doing its regular job. In addition, it's doing the job that the core is supposed to be doing, the hip's supposed to be doing. So it is very important to have hip mobility, hip strength, ankle mobility, ankle strength, stability, and you want to make sure you have core strength.
Yeah.
A lot of times people think core strength, I want to get abs.
Yeah.
Right?
It's not, and this goes back to the whole, it's not as sexy, right?
Yeah.
To think about the type of core strengthening that can be really helpful for preventing pain. Because it's not getting that six pack. It's really doing things that work some of those smaller muscles that may not be as aesthetically pleasing, but have a huge impact on how well people function in the day-to-day life.
Yes. And for the people out there that are training for aesthetics, which I don't think there's anything wrong with that.
Yeah.
But you have to remember, even in that scenario or those situations, if you eventually can't train anymore, you're going to lose those aesthetics as well.
Yeah.
So you want to take care of the little things so you can keep up with your routine.
Exactly. Yeah, I think a lot of times people often forget the importance of these smaller muscle groups that are so vital to doing some of these bigger movements.
Yes.
That we've been alluding to this whole time. So yeah, I think you've kind of hit it on the nail. Core strength is invaluable for working out and, like I said, even day-to-day things that we take for granted.
I'll get one more. Good. Yeah, those are like, and I think if you want a general rule of thumb, core strength, hip mobility, ankle mobility.
Yeah.
If you have those things, chances are you're going to prevent a lot of injury that's going to happen. And most injury, correct me if I'm wrong, is cumulative.
It can be, yeah. I would say unless you're doing something where you're in a sport or something where you're putting your body in a position where you could get hit and move in a weird way that puts more stress on it, it's usually a chronic overwork or like this repetitive movement with faulty mechanics that leads to most injuries.
Yes. Yeah. It's also, and you hear this all the time, I just woke up one day and I threw my back out.
Yeah.
Oh, I just threw my knee out. Like, no.
Yeah.
No. You were doing something prior to that one you probably ignored, right? Or two, you just, in addition to ignoring, like you didn't address the proper stretching or strengthening that you could have done where that wouldn't have happened.
Right.
What do you say to people who, as they get older into their, 40s, 50s, even into the mid-30s? I saw this Instagram meme one time, and this dude was like, how you get out of the car to go to the gym in your 20s versus your 30s.
Yeah.
And when he got out in his 30s, he's like, holding his back.
Yeah.
And I'm thinking in my head, like, but it doesn't have to be that.
Right. Yeah,
Yeah.
I think the earlier you address it, the better. Like the earlier you get in these healthy habits of, again, the things we talked about earlier, eating right and getting in the habit of movement, the better you are preparing yourself for later in life.
Yeah.
There's this interesting quote that I love from a book that all of us are older adults in training right now, regardless of what age you're at, right?
Right, I love that.
And you can do so much now to help your future self in just moving on a day-to-day basis.
Yeah.
Because I do think we associate age with decreased function or decreased ability to go in and be in the gym. But that's not the case for everybody. You see these awesome videos of people like in their 90s picking up heavy barbells, moving it. So it's not necessarily a predetermined thing that you're going to get weaker as you get older.
Right.
You just have to put in the effort to prevent that, really.
And the more you learn, your body could actually work in reverse, right? So it's like as you get older and you learn what foods are more beneficial for you, you learn what movements to do, you learn how to strengthen the right areas and the proper mobility. You could actually get stronger and have more injury prevention as you get older.
Absolutely. Right. I like that viewpoint on it.
Yeah. It's cup half full.
Exactly. I like the optimism.
Right. Yeah. It's very important. So now we have back pain, and you said a lot of people. What do you feel about MRIs, X-rays? When those should be done? When it's an indicator to just stretch more, or I should just go get this looked at?
Yeah, I think a lot of the times people think the more information they have, the better. So I want this MRI because I have pain. It's going to tell me exactly what's causing my pain. Unfortunately, it's not quite how it works in the real world, right?
Okay, give me more.
Yeah, so I would say like if you take the average person off the street and throw them in an MRI, let's say they're in their 30s or later, they're probably gonna have something show up on their MRI, regardless of if they have pain or not, right? We expect things like wrinkles on the outside of our body, but like if you take an MRI and start to see these things that we call degenerative changes, those are like the wrinkles on the inside of our body. It's gonna happen over time.
It's gonna happen.
But it doesn't necessarily mean that you're set up to be dealing with pain or injury. It's just part of the process. And I think the stronger you are around those structures, the less likely you are to have pain.
So we want to address the stretching, the strengthening initially.
Yeah.
Like that's where we want to go first because, and I've seen this happen. You go to get an MRI or X-ray and they're like, oh, it looks like you have, mini fractures or, you have these issues, then you start going through things you probably don't even need to do.
Right. It's the worst. Like someone will say, oh, you have the back of an 80-year-old. It's like, okay, well, that's going to automatically put you in this fearful state that, oh, now I actually should have really bad pain based on this. But it's not always the case.
Yeah.
And I think trying to do things that are more conservative first is the route to go. Now, if it's not getting better, that's where maybe getting an X-ray or MRI can help guide us in what are the next appropriate steps.
Right.
But most people don't have to get that point.
Yeah.
They get better with a lot of these other things.
I like what you said. So addressing to see if you can get better on its own, which is like just having a solid stretching routine, which is important. How often do you stretch?
I stretch probably 5 or 6 days a week. I try to, switch it up. I try to incorporate it into my regular workout routine, right? So I try to work out 5 or 6 days a week. And I'm doing something like we talked about as a warm-up, which includes more mobility practice. But like true stretching, I try to do at least at the end of my routine. If I'm taking a time where I'm not quite as active, I still usually do something to help my body recover from its day-to-day workings through some sort of stretching mobility workout.
And I asked because I was having this conversation with a friend the other day, and I said, even as a trainer, I enjoy going to work out maybe 50% of the time.
That's fair.
The other 50%, I'm complaining the whole time.
Yeah.
Literally, I'm like, what the hell? And it just literally happened last week. I say, I'm going to do a 4-mile run. As I'm getting ready to do the 4-mile run, I'll say, okay, I'm going to leave at this particular time. 30 minutes later, I still haven't left yet.
Yeah.
Right? So I was like, okay, Gene, just start stretching, then we can get out here and get it done. The whole time, I'm like, I don't want to do this shit. I go while I'm doing the run, and good. Yep. I'm still complaining.
Yeah.
I'm still complaining. I'm like, I don't want to do this. I don't want to do this. I finished the run. I'm like, that was stupid. It still sucks. But when I woke up the next morning, I felt amazing.
Yeah.
Right? So I say that to say with the stretching, almost adopting the same mindset. It's not going to be as difficult as going to do a workout, but convincing yourself when you have a full schedule and you're working and you're running around, if you have kids or if you have obligations or deadlines, like to convince yourself to take a few minutes to stretch can sometimes be tedious and annoying. 100%. So you're not always going to feel like it, but understand that tomorrow you is going to be thankful for it.
Exactly. And I think you can almost use that time as like me time, if you will, in those busy schedules. Like it's a little bit of almost like a meditation practice at times where you're just like one with your body during that moment. Or if you're the person that like really enjoys music, throwing on something to make that stretching time more enjoyable can help kind of coax you into it being like something you actually want to do. But you're right, there's definitely going to be days where you're like,
you're not going to want to do it.
Hit the snooze button, spin a little bit longer.
Yeah, then get up and stretch.
Yeah.
And do this stupid ass stretch.
Yeah.
What I like what you said is kind of coupling it with something else.
Right.
Whether it's your favorite TV show, whether it's your me time. Okay, now it's not just stretching. Let me do this with something else that I don't consider so much of a time waster.
Exactly, right? Exactly. I think that like, we call it almost like a habit stack. It's like, maybe you're the person that watches the show pretty consistently every day, but it could be pretty easy to just add this extra 5 minutes to watching that show and just doing a little movement while you're doing it. Yes,
yes. I know for me, I have my normal training hours where I'm training people during the day, and then I have my computer hours where I'm working on back-end stuff. I try to save that for my stretching time.
Oh yeah, okay? I like that, yeah.
So and I think we've all done it. You're working on the computer, it's boring. Okay, I use a stretch to wake me up, and then I go back to the computer. So that's how I'm gonna use your term now, habit stack.
Yeah.
That's how I habit stack. Okay, so I know I need to do my back end work. I know anytime I go to do my back end work, I'm gonna couple that with some stretching.
Yeah, I love that. That's perfect. And it's enforcing movement in those activities that have to be more sedentary.
Yes.
So, yeah.
Exactly. What are some of the professions and I don't want to say maybe specifically professions, but what are some of the mechanics or repetitive body movements within professions that you've seen that lead to certain kind of pain? Like what are certain things people doing during the day? They'd be like, I need to make a mental note of this.
Yeah, so I think you kind of hit it on the head early with the tattoo artist, right?
Okay.
So certain people have demands where they're stuck in one position all day long. I work with people that like style hair and they're kind of up here all day long, so sometimes they deal with shoulder pain because they're just in awkward positions for an extended period of time. The other population we see a lot of are the people that have to do a lot of repetitive movements, like picking up boxes. So like some of that might be delivering packages regularly, or in some sort of warehouse where they're physically having to move a lot, but maybe not thinking about how they're moving each time they do that.
Yeah.
That accumulative stress can sometimes lead to these chronic pain conditions or these injuries. Yeah.
So we're looking at if you have a job or an activity that you're in one position for a long time, or you're doing a movement repetitively over extended periods of time, these are things that you want to kind of pay attention to at the end of the day when you feel a little bit of pain.
Yeah, and I would say one of the most common jobs where you're stuck in a position all day can be a little bit uncomfortable is actually just being behind a desk.
Yeah.
Right?
Yeah.
I think that we think that that's like very low demand on the body, but a lot of people deal with neck pain and back pain just from being stuck in those postures all day.
Yeah.
And not getting that regular movement that our body craves.
Yeah. So what is the chain effect? If you can elaborate a little bit more on that. So you're in a sit, and I like that because sometimes we think because we're in a seated position, our body's at rest.
Right.
That's not necessarily the case.
No, and again, I think depending on how you're sitting, you can actually be putting more stress on different structures. Like a lot of times we'll see people sitting where their head's really far forward and the head's not light by any means, right? It's almost like a bowling ball stacked on our neck. And that can put a lot of stress on the neck. Those muscles on the back of the neck can get overworked because it's trying to hold up your heavy brain, right?
Right. For all the thinking that we're doing all day, yeah.
So I think that's where it's important to recognize, like check-ins with your body to see, ooh, am I in this position for a little bit too long? Maybe I should sit upright. I tell people like putting a Post-it note where they can see that and get that mental reminder repeatedly throughout the day can be helpful. Some people set reminders to go off on their watch to check them. Like the Apple Watch tells you to stand up like on the 50 every hour if you haven't moved. Like those types of check-ins can be nice. Yeah. To give your body the movement, like I said, that it craves.
Yeah. So having those check-ins with yourself and understanding when it could even be watching TV for too long. So those binge shows where that people are watching, it's like, okay, then you have this pain. I had this one client where we couldn't figure out where her back pain was coming from. Come to find out, the couch she was sitting on was a little lopsided and it had her hips in a very uneven position for an extended amount of time. So it's like, okay, well, that's something to look at. So even if it's something that you consider leisure, make sure that you're not getting up and you're like, feeling super tight.
Right, exactly. Again, it goes to listening to your body. And yeah, I think we, again, think about these like heavier activities as being things that are stressful on our body, but some of the things we take for granted on a day-to-day basis can actually be creating that stress.
Oh, for sure. Well, I want to thank you for coming out and clarifying a few things, and hopefully people could take this into consideration to be a little bit more preventative.
Yeah, I love it. Thank you for having me on today.
I appreciate you.